Why do bleeding ulcers requiring blood transfusions? Imagine a tiny tear in your stomach or the upper part of your small intestine that starts bleeding heavily. That's what happens with bleeding ulcers, especially peptic ulcers. These ulcers can erode blood vessels in the stomach or duodenum, causing significant blood loss. When the bleeding is severe, it can lead to a dangerous drop in blood volume and hemoglobin levels, which is the protein in red blood cells that carries oxygen. Without enough red blood cells, your vital organs like your brain, heart, and kidneys don't get enough oxygen to work properly. This can cause symptoms like dizziness, weakness, rapid heartbeat, and even fainting. In some cases, bleeding from an ulcer can be sudden and massive, leading to vomiting blood or passing large amounts of bloody or dark maroon stools. When blood loss is this extensive, the body struggles to keep up. The blood pressure can drop dangerously low, and the person can go into shock, which is a life-threatening condition. To prevent this, doctors often use blood transfusions. These transfusions involve giving the patient packed red blood cells, which are concentrated red blood cells taken from donated blood. This helps restore the blood volume, increase the oxygen-carrying capacity, and stabilize the patient quickly. Blood transfusions are usually indicated when the bleeding is severe enough to cause symptoms of shock, such as very low blood pressure or rapid heartbeat that doesn't improve with fluids. They are also used when the hemoglobin level drops below about 7 grams per deciliter, especially if the patient shows signs of ongoing bleeding or organ stress. For example, if a person loses about 1,000 milliliters of blood in a short time or their hemoglobin drops rapidly by 3 grams per deciliter within a few hours, a transfusion is often necessary. This helps prevent complications like heart strain or damage to other organs caused by insufficient oxygen. It's important to remember that blood transfusions are part of a broader treatment plan. After stabilizing the patient with transfusions, doctors may perform endoscopic procedures to stop the bleeding, give medications to reduce stomach acid and promote healing, and monitor the patient closely. While transfusions are crucial for severe bleeding, medical guidelines recommend using them carefully. The goal is to balance correcting anemia with avoiding unnecessary transfusions, which can carry risks like allergic reactions or infections. In essence, bleeding ulcers requiring blood transfusions because the blood loss can be life-threatening. Transfusions help replace lost blood, restore oxygen delivery, and stabilize the patient so they can safely undergo further treatment to heal the ulcer and prevent future bleeding. Always consult healthcare professionals for personalized advice and treatment options, as each case can vary.